Hi, this is Dr. Bill Berkowitz of Life Chiropractic in Grass Valley. Let's talk about the 4 critical legs to successfully resolving chronic headaches. Let's start at the basis. If you have headaches on a regular basis, it's indicative of an imbalance. The body should not express headaches, so there is an underlying imbalance. That imbalance is due to long-term stress. It could have been trauma that started it, but there's ongoing stress. So let's look at what that stress causing that imbalance has done and how to address it. You first want to, the first step, the first leg is looking at triggers. And the more common triggers are your posture, the posture of your neck and your shoulders. Here's something to try right now. Lower your shoulders. If you can lower your shoulders, it's a sign you're carrying excess stress and tension. And as your shoulders come up, it tightens the muscles of your shoulders and your neck, which is one contributor to headaches. You also just want to pay attention to how you stand. Ideally, you want to stand on both feet evenly, not shifted to one side or the other. And when you sit, the same thing, sit on both sit bones. Do not cross your legs. That's going to pass tension all the way up your spine into your neck and shoulders. Critical leg number 2 is we want to turn down the fight or flight sympathetic nervous system. That's the part of the nervous system that drives muscle tension, drives pain, increases inflammation, interrupts sleep, interrupts digestion, increases heart rate and blood pressure, and suppresses the immune system. And at the same time, we want to increase the tone or the activity of the vagus nerve. The vagus nerve is the parasympathetic system, often referred to as the rest and digest system. The vagus nerve will cultivate rest, relaxation, quality sleep, a better immune system, lower inflammation, lower muscle tension, lower pain. In my practice, I commonly will teach people some breathing practices. I will teach them how to breathe properly. I know that sounds crazy, but most people are breathing improperly. In fact, you can check this out for yourself. Go stand in front of a mirror. Hit pause on this after I describe what to do. Go stand in front of a mirror, the bathroom mirror, and take a couple of fairly full breaths. Not an exorbitant, huge breath, but just a full breath, a couple of them. And observe where you see your body moving. Do you see the movement in your stomach or abdomen? Do you see it in your chest? Do you see it in your shoulders? Do you see the muscles of your neck move? And then come back. Hopefully you did that in your back. If you saw movement in your chest, shoulders, or neck, you are breathing improperly. And the way you are breathing is driving increased tension, especially through your neck and shoulders. So that will help increase the vagus nerve by breathing properly, as well as some breathing practices, and we'll start to turn down that fight or flight system. The third leg is to find and correct the source that's driving the headaches. Now, the source likely led to improper breathing, which has perpetuated the headaches and has created that imbalance in the nervous system. But we want to look at the source. What's causing this? The first place I always look is the cervical spine or the neck. I want to look at the curve of the neck. If the curve has straightened out, it is putting tension on the nervous system, increasing tension and spasm in the muscles of the neck, which is causing headaches. We also want to look in the upper neck, because that's where the brainstem is. And the brainstem is the home of that nervous system that I just talked about, that vagus nerve. In front of the first vertebra in the neck runs the vagus nerve, and if that vertebra is out of position, it irritates that vagus nerve and lowers the activity. I want to specifically look at the top 2 vertebrae in the neck, because they control and influence how the brainstem works, how that sympathetic fight or flight and vagus nerve works. And then I want to look in the lower cervical spine, because the spinal cord is tethered or attached at C6 as well. We also want to look at the rest of the spine. We want to look at the foundation and the pelvis and make sure that's level. But the cervical spine is the most prominent aggravator, perpetuator cause of headaches. And the fourth leg is quality sleep. Now, this is a double-edged sword, because if you have headaches and you have sympathetic dominance, that fight or flight system, then that's going to interfere with your quality sleep. And the interfered sleep is going to drive inflammation and muscle tension, which is going to affect sleep, and it becomes this self-perpetuating cycle. But it is really critical that you have a sleep habit or sleep hygiene that feeds sleep. And as we reduce those triggers, as we correct the cause, sleep will improve and it will help with the headaches. So you want to have a regular time. You want to carve out a minimum of 7 to 8 hours of sleep. And if it's 7 hours of sleep, it's probably at least 7.5 to 8 hours of time in bed. You want your room to be dark. You want it to be cool, certainly below 65 degrees. You want to avoid stimulants from, say, noon on. You want to avoid alcohol. You want to stop eating a couple of hours before you go to bed. And you want to avoid stimulating things, lots of screen time. It'd be a great thing to read for a little bit, or do some breathing practices for 10 or 15 minutes before you go to sleep. You want to cultivate good sleep. In the morning, the best thing you can do is to get up, get outside, and look in the direction of the sunrise. You want to expose your eyes to natural light first thing in the morning for 5 minutes or more, and that will help program your sleep cycle, or what we call your circadian rhythm. For more information, go to my website, lifewithinchiropractic.com. That's lifewithinchiropractic.com. Also, make sure to subscribe to all my social media channels where I post on a regular basis. I look forward to meeting you.